This is Earth. By the year 2012, it will be home to more than 7 billion people. This is the United States, where right now more than 300 million people live and work every day. Of those, roughly 12% are seniors, people aged 65 or older. That's about 40 million people. And by the year 2050, that number will more than double. The fact is, with better technology and better medical resources, Americans are living longer than ever. What does that mean? Well, for starters, a growing population of seniors who will eventually need long-term care. And many of those will also require skilled nursing, rehabilitation services, and even home health care. When you think about it, that could mean a big boost to our economy. Here's why. The U.S. healthcare industry employs more than 14 million people every year and accounts for more than $2 trillion in annual spending. So, greater need leads to more spending, leads to more facilities and more jobs, leads to a stronger economy. But hold on just a second. It's not that simple. When it comes to caring for our seniors and paying for that care, we have to remember an important truth. The long-term and post-acute care sectors of America's senior care industry are closely tied to Medicare and Medicaid funding, and that funding saw some pretty big changes recently. In October 2011, new rates went into effect for Medicare reimbursement at skilled nursing facilities. That means skilled nursing facilities across the country could see an average 11.1% overall rate cut, depending on things like individual patient care needs and the location of the facility. Not only does this change affect patients, but it's also affecting a whopping number of facilities and their staff members. In fact, even before the new rates went into effect, a lot of facilities were already cutting projects and letting go of employees. The bottom line? The lasting effects could be crippling to an industry that's vital to our national economy. So say you're a facility owner or administrator. What can you do to protect your residents and your workers? Simple. Make an investment in both. Let's consider that in the current long-term and post-acute care environment, optimal reimbursement is based on three very important things: that facilities provide effective, efficient care and document it properly, that risk and unnecessary expenses are kept to a minimum, and that all billing is accurate the first time, every time. Sounds sensible, right? Right. So how do you make it happen? The answer is the right training solution. Join Care to Learn for Part 2 of our video series, Overcoming Reimbursement Challenges Through Training, and find out what it takes to implement and maintain a training program that will save you time and money.